in each child case, if child born is there, so contracture already developed and you did some surgeries and the contracture released right now. For lifelong, whether he has to maintain any protocol or he can live freely.
Not lifelong. There is some duration for at least 6 months to 1 year. He has to follow some strict physiotherapy protocols. Once it is done, once the graft on the skin wound is matured completely, then he can leave it later on. But lifelong, it is not required.
Okay.
So there is strict protocol is there. There will be rehab, there will be physiotherapy, and there will be proper splinting. They should be followed strictly for 1 year. Once it is done properly, after that they can be splint free and they can continue their own job.
So let's talk about the medical and surgical part. What you basically do on the surgical or medical treatment for a burn injury patients. Sir, you do skin grafting. So what role does skin grafting plays in a burn injury?
Skin grafting has a very, very major role in burn injury. See, because whatever burns, the deep wounds are there, deep burns or completely full thickness burns, the burn skin is completely dead. The skin will come off, either we remove it surgically or it will come off through the dressings. Once it has come off, the wound is raw. We have to cover it with something. So we take skin from the thighs of the patients and we take that skin and we just put it on the wound. Once the wound is healthy without any infection, then we put the skin graft and the wounds will heal. This is a very, very important thing. There are some patients who will be not undergoing skin grafting. If they don't undergo skin grafting, it will take a longer, very, very longer duration of time for the scars to heal. And they'll be healing by contractions. The wound will contract eventually, and again there will be crippling contractures because of that. So in that way, skin grafting is a beautiful tool for burn patients. So if skin grafting is not there, it is very, very tough.
Sir, basically patient when comes to you with a deep burn injury, what are the stages you take? What are the treatment stages you basically follow?
So whenever patient comes, if it is a deep burn, we'll admit them in the ICU. The initial critical phase will be managed in the ICU. We'll be doing regular strict dressings. We'll be giving aggressive fluid management, fluid resuscitation. We'll monitor the patient's urine output. Once the patient is out of the critical period, then we'll assess the burn wounds, how deep they are, how much part is deep, how much part is superficial. Then we'll assess either if the burn wound, deep wound is very less, we'll manage it by regular dressings. And if the burn wound is very big, then some patients require early debridement, early excision. So we'll excise the wound and we'll wait for the wounds to heal. And once the infection settles down, then we'll put another stage, we'll put a skin graft. So, and once the skin grafting is done, they have to follow post-operative splintage and post-operative rehab. Everything is there. So it is a very long stage and multiple surgeries may come. And if it is a very, very large area, so we divide into stages. Initially, if it is the whole body, so initially we'll graft the lower limbs so that patient can start walking. And in second stage, we'll graft the upper limbs. And third stage, we can graft. If it is a small area, we can do it in a single stage.
Okay.